Mitt Romney has said it very plainly. If elected, he will absolutely act to repeal, his words, act to repeal Obamacare beginning day one in office. And I want to just keep in mind here, Democrats considered the health care reforms their biggest achievement in decades. It was landmark legislation, and that includes the provision that bars insurers from denying coverage to people with pre-existing conditions, people like and Romney, who is to address this convention this evening. And Romney is a breast cancer survivor and was diagnosed with multiple sclerosis back in 1998. So with me now from New York is our senior medical correspondent, Elizabeth Cohen here. And Elizabeth, just beginning with you, when we talk pre-existing conditions, where specifically is Mitt Romney on that?
Mitt Romney is very clear that he will repeal Obamacare, and that means people with pre-existing conditions would not be guaranteed the ability to get insurance. Insurance companies would not have to take them. Instead, what Governor Romney wants to do is he wants to make it so that someone with a pre-existing condition would be able to get health insurance if, and this is a big if they have had continuous coverage in the past. So let's listen to Mitt Romney in his own words.
Let's say someone has been continuously insured and they develop a serious condition, and let's say they lose their job or they change jobs, they move and they go to a new place. I don't want them to be denied insurance because they've got some pre-existing condition. So we're going to have to make sure that the law we replace Obamacare with assures that people who have a pre-existing condition, who've been insured in the past, are able to get insurance in the future.
So if someone then has not had continuous coverage in the past and they want to get insurance and they have a pre-existing condition, then there would be no guarantee at all. Brooke?
Then what does it mean, Mitt Romney, what does he mean when he says, he talks about continuous coverage, as in people will not be denied access to a health plan while they have continuous coverage? Is that a qualifier?
Right, it is definitely a qualifier. He says if you have a pre-existing condition and you've had continuous coverage in the past, and then let's say you lose your job, he says, yes, you should be able to get new insurance, even though you have cancer or heart disease or whatever. Now, we asked, what does continuous coverage in the past mean? What does continuous coverage mean? And we didn't get an answer on that. We don't know if that means you have to have been insured for the prior 1 year or 2 years or 5 years or 10 years. We just don't know.
Okay, Elizabeth Cohen, stand by, because I want you to throw a question at the good senator sitting next to me. We have Senator John Barrasso of Wyoming. Also, we should point out, goes by Dr. Barrasso. So nice to see you here in person.
Brooke. Thanks for having me.
I want to just begin with this. You know, Obamacare really gives a lot of financial assistance to folks, middle-income folks, when it comes to buying insurance. If Mitt Romney makes good on the promise that he will be repealing Obamacare on day one, how will Mitt Romney help people buy insurance?
Well, first of all, you may have seen the New York Times editorial on Sunday that showed that a glitch in the law says that what the president has promised is very unlikely to happen, which is why I thought people actually should have read the health care law before it got signed into law. As Nancy Pelosi said, first you have to pass it before you get to find out what's in it, which is why today this is still a very unpopular law. Americans across the country more would like to have it either fully repealed or partially repealed
But then with regard to Mitt Romney, so if he wins and if he does repeal Obamacare, for the people who are watching and thinking, how will I get insurance? How will he help those people?
Yeah, well, first of all, what I'm saying is that with the promises what you have, you can keep it. They cannot.
But what does Mitt Romney do?
Yeah. What he wants to do is start over in a step-by-step way to let people buy insurance across state lines, let people who buy their own insurance have the same tax breaks as those who get it through work, deal with the lawsuit abuse that's out there, let small businesses join together to get better prices on insurance, all of those things. But the president continues to confuse the words coverage and care, and he talks about sending out 17 million Medicaid cards for people, but those people aren't able to find doctors to take care of them. There is a huge difference between the coverage that the president talks about and care that people need.
If I may, Elizabeth Cohen, go ahead and jump in. Go ahead and throw a question to the senator.
Senator, I have a question about children and pre-existing conditions. Let's say if Romney is elected president, let's say there's parents who work hard, but like many people, their employer does not give them insurance. They don't qualify for Medicaid, so they're not buying insurance. They're uninsured. And then that child, let's say, gets diabetes or cancer. If Mitt Romney were elected president, how would that child get insurance?
Well, I will tell you, my wife is a breast cancer survivor. She's been through 3 operations, 2 bouts of chemotherapy. So as both a doctor who's practiced for 25 years,
Wow.
as well as a husband, I will tell you it's important that we help people with pre-existing conditions. In Wyoming, we did that with a high-risk pool that worked well. Absolutely, there were subsidies for folks with pre-existing conditions. But I will tell you, definitely, it worked in a lot better way and fairer way and cheaper way than what the government is proposing, which is unworkable, it's unaffordable, and it continues to be very unpopular.
Senator, if I could ask, not all states have high-risk pools, and even the ones that are out there don't always work very well. So what would happen if that child were in a state without a high-risk pool?
Well, I think that if states would model what they have over the states that are successful, like the ones we have in Wyoming, there is a lot to be done to help people. The problem with the Obama health care law is he does something called guaranteed issuance of insurance. So we're not even talking, he defines pre-existing conditions as if somebody wrecks their car today and is being driven to the hospital, and this is somebody that doesn't have insurance because they haven't followed his mandate. Well, then the insurance company has to sell them insurance while they're on the way to the hospital with their bones sticking out through their leg. And that is not what most people think of as a pre-existing condition. We need to help people with pre-existing conditions.
Elizabeth Cohen, thank you very much, and I wish I had more time with you. Come back. As always, we enjoy having you on the show.
Great to be with you.
Barrasso, thank you.
Thank you.